This is good practice for me since I haven't taught since June.
So this is kind of fun as I have told the class, while we were trying to figure out how could we bring in guest speakers, and we're all sitting here going, well, this is like the coolest thing in the universe because I can bring in people from everywhere. And so literally we are going to have guest speakers all semester. From Ohio, Leanne Clark Shirley's coming. So Dr. Clark Shirley is going to come. I'm trying to get Dr. Sprouse to come. Dr. Brown out of UNCC, trying to get her to come. Dr. Kenny Williams out of Virginia. So I'm trying to get a lot of fun, energetic, great speakers to come. And so let me kind of just give you guys this background of gerontology is the study of aging. And so what Dr. Niles Yokum does is she works a lot on policy. And so since we're doing aging and social policy, we invited her, since she wrote the textbook, to come and talk to you guys. So what I'm going to do is I'm going to turn it over to her. It is on record, so I've got it recording. And if you guys will keep your mics off until toward the end, and then we'll open it up for questions. And we just want to say thank you for coming, Dr. Niles Yokum, and it's all yours.
Thank you. Thank you, Dr. Brown. Hello, everybody. I'm super happy to be here with all of you. Like I said to Dr. Brown, it's good practice for me. We don't start our classes here until end of September. So we're on a term system here at my university in California. So I have a little bit of time to get up to speed. But I'm really excited to be here to talk to you about social policy. I have some questions for you. I'm going to use some examples. One thing that students often get confused about or have questions about is the difference between social policy and public policy, right? And the two are not mutually exclusive. So I have, let's see, down here. I have a little bit here on what is social policy, right? And then I'm going to tell you about how the two are kind of connected. And what social policy is really just what it sounds like, right? We really want, if you study social policy or interested in social policy, you really want to understand what we do as a society, how we're organized through our programs and our public policies, and the way we think about things. In this context, we're really talking about aging, right? So how that affects well-being. And again, in this context, the well-being of older adults. So when we study social policy, we're really thinking about how we can make things better, right? But we do that in a systematic and planned way, a purposeful manner, as the slide reads here. And our end goal or the outcome is always to improve the quality of life for folks using what we know and the research. So here's really the difference before we get started here and I start giving you some examples. Where public policy and social policy meet are when we're thinking about things like public health, criminal justice, and things related to aging, healthcare, even our federal budget and what we spend our money on. Those come into play with public policy, right? So that's any policy that can be taken up by the government and legislated. Some of the issues that we are concerned about in the context of aging and gerontology, and in particular to my research, which is on loneliness and social isolation, which has been a huge deal, right? And particularly in the time of COVID and Corona. That's a really big deal. And I have some stats on the impact of social isolation and loneliness that I'll talk about in a minute. But some of the other issues are homelessness. I don't know if you've talked about this yet in Dr. Brown's class or other classes that you have talked about, but the rate of homelessness among older adults is increasing dramatically, particularly in major metropolitan cities, but everywhere, really. Elder justice is another thing that we think about in terms of social policy, healthcare, as I mentioned, and our federal budget. And really, the federal budget piece of it, all of this is contextually grounded in how we feel about a certain population, right? So how we feel about older adults and the money we spend on them. So if you were to take a look at the federal budget and look at aging programs, for example, the Older Americans Act, right? So if you just look at the National Family Caregiver Support Program, how much money, right? When that was first enacted in 1998, sure, we got it passed, right? So it became public policy, it became law, but it was not funded. So what good does that do if something's not funded? And so a lot of the aging programs that we have now are on the books, but they've been flat in terms of the budget and the monies that have gone to them, or reduced. And so I maybe keep in mind as we go through this presentation here, if you follow the money, it really shows you what the values of a society are, and what we decide to spend our money on. And really the question is for you to keep in your mind is, how do we decide what's important? That's a critical question. So I talked about loneliness. Here are some of the health risks that maybe you weren't aware of. And actually the CDC has declared that social isolation is a public health issue, and particularly for older adults. So I'm not going to go through all of this. I think Dr. Brown will give you access to this PowerPoint. You're welcome to have it. But if you look at that second bullet there, social isolation is associated with about half of the increased risk of dementia, 50% increased risk of dementia. Higher rates of depression, anxiety, and suicide. So basically, loneliness and social isolation can actually be more, what's the word I'm looking for? More impactful, more dangerous than our chronic conditions, high blood pressure, heart disease, and particularly for older adults. And if you just think about your own self and what we're all going through right now, not being able to be with our people or not being able to be with them in the way that we want to, welcome to old age. Welcome to how a lot of older adults live their lives. And it's definitely an issue. So when we look at variation among policies and programs, you can look at the social programs and how they're kind of put together, how we decide what's important. Basically, we look at things like in what form do they come and have they been developed? What are the eligibility criteria? How do we finance them? And do we decide whether they're universal, for example, for everybody over the age of 60, or are they selective? We'll talk a little bit more about that. So when we talk about eligibility, there's age entitlement and need-based programs, right? And the form of benefits, are they direct or indirect? So those are some things that we consider when we're talking about social policies and how they come to be and how they should come to be. So when I talk to my students about social policy and the development of public policies, I always frame it and I always ground it in our values, right? As I talked about in the beginning, that really, the policies that we have in a society, they reflect our values. So again, it comes back to what are we funding or not funding? What are we taking away? What are we keeping? So some values that affect us here in this country in particular, we think about things like, what is the responsibility of the person, right? What is the responsibility of both the individual and the community? And then if you throw in there the views of older adults, and by that I mean, how do we feel about older adults in this country? So if we feel that it's the responsibility of the person, if you go back to your Soc 101, if any of you have had intro to sociology, it does us no good to think about, just pull yourself up by your bootstraps. whatever happened to you is your fault. If you think back to the Great Depression, that was really the first time that we saw that people who followed the rules, people who did what they were supposed to do, people who were working, people who were saving, bad things happened, right? So that was when the Social Security Act was enacted in 1935, just a few years after that, because we realized we needed a safety net, and we needed a safety net for older adults. So that responsibility, I'm a big believer in the social contract, and that is for the greater good, right? So the individual versus community, I think we all have a responsibility for that. And that is the way that our social policies and that our public policies should be formed in that content. So if we look at these specifically, really, as it says here, rooted in our history and culture, everything that we know and that we've been through underlie all of our public policies. So the things that get enacted, the things that get formed, and there's a lot of debate around this. So, and it does come down to politics. There's a lot of politics right now. We are in the middle of a pandemic, and it's still politics. You know, wearing a mask or not wearing a mask has become a symbol of our values. So we know that if this is how I feel, and I'm a guest here in Dr. Brown's class, so I'm going to say that I wear a mask to protect the people around me. And that's because I believe it's my responsibility to have a healthy community. We wear seatbelts, we follow other laws, we stop at red lights, and we don't feel burdened by that, because we know if we don't wear that seatbelt, or we go through a red light, or we don't stop at a stop sign, somebody else is going to get hurt by that. So if you think about our values and people that feel like public policy or social policy doesn't affect their daily life, it affects every aspect of what we do. And if we feel that older adults don't matter or they're not productive, that's going to be reflected in our policies. It's also going to be reflected in what we decide to fund or not fund. So number 2 there, welfare is a matter of common stake and responsibility of both individual and community, right? So we have a responsibility to our own selves, but we also have a responsibility to our community. And when we segregate older adults from the rest of our community or the rest of our society, that's when we start to see really what the values of a society are, right? Just a little history on the development of policies for older people. So I mentioned a little bit about the 30s. So I just kind of put this in decades and chunks here for you, so we didn't have to go through the whole thing. So the 1930s to the 1950s, if you kind of think back on history and remember what was going on in those times, that's when we've seen action taken based on what was going on in our society at that time. So for example, the 30s and the Great Depression, the 1950s, and what was starting to happen with civil rights. And the 1960s to the 1970s was a very active time for older adult policies that were really being thought about and enacted. That's when we had the Older Americans Act in 1965. That's when we realized we needed more supplements, more amendments to the Social Security Act. So there was supplemental security income. And then we really started to see in the 80s a rollback on that a little bit in terms of our values. There were program reductions, and we really started to see, pull yourself up by your bootstraps. We're not going to fund these things. And that was really kind of an era of the market and personal responsibility and entered the 21st century. And I have a student right now who's working, her dissertation is on older homelessness. And so she's doing a policy analysis on the history of those policies that impact homelessness, starting from very early on to now. And if you look at the objectives of the Older Americans Act and what's been funded and what's been rolled back, and you can really see where things have changed in our thinking as a society. So remember that social policy is really the study of, what impacts well-being and quality of life for people in our society, and in this case, older adults. So you can really see a big change there as we got along. I have a few, just an example, I'm using Social Security as an example here, right? So Social Security was enacted because of a historical event that happened, and that was the Great Depression. So we really were at that time thinking about shared responsibility, that we all have a role to play and that there should be a standard of living. And so that's what was happening at that time. And then, as I said, SSI was passed shortly after that. So this is a little old. This is the ratio of workers to Social Security benefits. There's a lot of talk about Social Security is not going to survive. It's not going to be around for younger people, millennials, even me as a Gen Xer, right? But you can see here in 1955, the workers per beneficiary, the historical line there, and how it starts to go down through the 70s, 90s, and then where we are now, that it's pretty flat. So there's been a lot of talk about how to fix this, how to protect people who've paid into it. And one of those is privatization. And for people like me, that privatization is a scary thought, right? I teach a lot in public administration and understand the context of government. But I think we've all seen the horrors of what can happen when things are privatized. And if any of you watch the news now, a lot of that's going on about the Postal Service. That's a discussion for another day, for sure. So again, we're back to the values, right? Values that are reflected in the current Social Security system are universalism, mutual responsibility, the national community part of it, the earned right, but most importantly, to maintain dignity, right? Social Security was really put in place to give people a base level of dignity in their life with a base level of income. So again, I encourage you to really think about the values, your values, and then also what are the values of our society, which you can see every day on the news. You can see every day, on Instagram and the videos that come through and what people are thinking and saying. So again, for people that think that policy doesn't affect their life, it affects your everyday life. Here's the privatization part of it. What the issues with privatization are: this primacy of individual responsibility, right, and a limited role of government and market economy. And on the face of it, that sounds great. But there are a lot of flaws in the privatization debate about this and the conversation that we have. And to say that the market is the most efficient and fair way to distribute resources, I think we've seen that the market is the market. And would I trust my future to the market? I don't think so. And the increase in national savings, that's also a big debate. Would that really be what happens? Are we really going to be saving? And I should have had a slide here, a chart to show our federal budget and what we spend our money on. And it's really not people. So and in particular, it's not older adults. Well, I have one of those slides, and maybe I'll send it to Dr. Brown, and it gives you a really nice visual of what we're really spending money on in this country. And it's not people. There are some other proposals to address funding. So when we think about social policy in the context of public policy and our values, some of the other conversations that are being had about the future of Social Security are reducing benefits across the board, right? Raising the cap on the amount of wages and salaries subject to payroll taxes, and then also an affluence test by eliminating benefits for higher income workers above an income threshold. And I'm not against any of these things, but what we know about policy is that it's never straight up, right? One side wants something and another side wants something else. Things get taken out, and so the debate is not on the face of it. The debate is in the details. So if you do an affluence test and you eliminate benefits for higher income workers, what is that threshold? Who decides what that threshold is? Who decides who's affluent and who isn't affluent? So those are the kind of questions that, if you're interested in policy, it's not always just on the face of it. The devil is in the details, for sure. So back to the Older Americans Act, right? Some of the social services that were put into place through the objectives of the Older Americans Act, which was passed in 1965, we did this also for dignity. We did this to make sure that older adults in our society have access to the services and programs that they need that maybe they don't have access to, right? So these are in-home services, senior centers and senior center programs, nutrition programs, legal assistance and advocacy. So these are all really critical things. But again, I encourage you to really think about, it looks good on paper, but are they being funded? And who has access to them? We know that about, I would say less than I haven't looked at the stats lately, but probably less than 5% of services and programs are accessed by older adults. There's a really great kind of org chart of how this stuff trickles down. So you have the Administration on Aging, you have state units on aging, and then you have the counties, and then you have the local service areas, the area agencies on aging. And it's a very fragmented, I'm working on some research right now on fragmentation in the aging network. And the fragmentation comes from that kind of trickle down, and how do communities decide how the money's dispersed? Any of you who are familiar with Meals on Wheels, there was a time recently actually where they were talking about slashing that budget by 50%. And this is a very basic service, having meals delivered to homebound older adults who can't get out, who maybe don't have family or caregivers. And so if you think about even that conversation, to say you're not going to feed people who don't have access to food or to get out to the store, or have the resources to feed themselves or get access to food, that is just a ridiculous argument. And to decide that nutrition and food is not important, to me, it's a basic human right to be able to eat. So another thing that happens with policy for older adults in particular is we talk about productivity versus entitlement. And one of the ways that ageism kind of sneaks into our policies and our programs is this view that older adults aren't productive anymore. They're not productive members of society, and so they should just take what they get. And I would remind you that anything related to older adults, whether it's peripherally or not, there is some ageism. You see it all the time, and unless you really start to think about it and have that in the back of your mind, maybe you wouldn't see it. But to say that older adults are less productive, so they deserve less, is one argument for sure. So we talk about the politics of entitlement, which are really political preferences for the allocation of resources based on the notions that older persons are needy. And I don't know how I feel about that, right? So on the one hand, we say, okay, they need things. And on the other hand, is that an ageist notion? But then are they deserving of public support, right? So the politics of productivity is that resources should be allocated based on the recognition of the diversity of the aging population. I live in California, and we have a very diverse, especially in Southern California, a very diverse population. And so recognizing that diversity is very important. So here's a kind of big, a big picture view of the policy making process in the United States. I won't go through this whole thing, but there's the policy formulation phase. And that's important because that's really where we start to set the agenda. And if we're setting an agenda that is rooted in ageism and rooted in these outdated notions that older adults aren't worthy, or not productive or undeserving, that's a problem right there, right? So we start to look at problems and possible solutions. Then we have the development of the legislation. So the implementation phase is super important too, because sometimes things get set down, but don't get implemented, or even more importantly, don't get funded, right? Feedback loop is really important. In this country, we allow citizens to give feedback on things, but oftentimes people don't know how to access that, or aren't even aware that things are happening. So I'll just leave that there for you. So I feel like I've been talking a lot, but I really want to talk to you about what matters to you, right? You're in this gerontology class. Maybe you're in it because it's a gen ed. I don't know. I mean, when I taught undergrads, it was a gen ed. So I got people in there. Sometimes students were like, I thought this was a geology class. It's like, no, it's gerontology and you're stuck here, learn about old people. But as I kind of wrap this up, the way that I want you to think about this and connect to policy, which is oftentimes boring to a lot of people, but if you can think about a way that you connect to some of the things that we've been talking about and the policies, I would ask you, what is the aging policy problem that matters the most to you, right? It could be caregiving. We have a shortage of caregivers in this country, and we also have a shortage of whether we're talking formal or informal. So, the direct care workforce in this country gets paid nothing. They get paid nothing, and we expect them to do everything. When COVID started hitting nursing homes and skilled nursing facilities hard, and people were walking out, direct care workers were walking out of their job and not coming back. That sounds awful, and we want to blame the individual. So it's an example of individual versus community. I didn't blame them one bit. They were not given the PPEs. They were expected to show up there at work, and weren't protected, and then bring things back to their family, or even get sick themselves. Some direct care workers are also at high risk and vulnerable. So even something as simple as caregiving or care work is an aging policy problem that matters to me and should matter to everybody, from pay to protection, across that spectrum. And to think about why you care about this issue. The way that we get people to care about an issue is to make them think about how it affects them. When I was working for the National Alliance for Caregiving, I was lucky enough to be able to go up to Capitol Hill and walk the halls and meet with staffers and give them our data about why that should be passed. And the best responses we got were from people who were experiencing caregiving themselves and saying, yeah, I wish I had more support. Yeah, I wish, I had this program existed because I need help. I'm caring for my mom, or I'm caring for my grandpa, or I'm caring for my spouse. So to make an issue personal is really the best way to get people to connect to it. But then you also have to kind of think about, why should others care about this issue? And I think when it comes to being an advocate for older adults, we all should care about that. I mean, we all hope we could get old someday, and we all want to live a dignified old age. And that can't happen unless we all care about the issue, and kind of expose it's overt ageism that exists in our current policies right now, in the way that we support or don't support older adults. So as a gerontologist, I have a PhD in gerontology and public policy. And I feel like my role is to be an advocate, right? So in everything that I do, I'm always thinking about, how is this going to impact the population that I care about and that I research, and that I will be one day. And that is the social policy piece of it, trying to ensure that our policies reflect our values. And that's a culture change, perhaps, maybe not in our lifetime, but we can always work towards that. Let's see, I think that's it, but I want to, so I don't have access to my office. So I think you guys have a newer version of this book. So I have an old version because I can't get into my office for my new book. But I wanted to kind of wrap this up with one piece that's that I used to wrap up chapter 15. And it's really about Bob Butler. So Bob Butler coined the term ageism, which I'm sure you guys know about, right? That's systematic stereotyping of older adults and discrimination. So I'll just read this here because I was too lazy to put it in my slides. So a great book, by the way. It's a very big book, but it's a great book called Why Survive? Growing Old in America. And I think he published that in 1975. So it's held the test of time for sure. But Dr. Butler, in his book, Why Survive? Growing Old in America, asks, why study the elderly? Why spend research money on old people when there are compelling priorities for other groups, particularly the young? Butler puts forth many of his own compelling reasons, but one stands out for our purposes here. A greater understanding and control over the diseases and difficulties of later life would hopefully make old age less frightening and more acceptable as a truly valuable last phase of life. The relief of human suffering has merit in itself, but it also releases human beings from the fears and defenses they build up around it. With that in mind, one final challenge and related questions remain, and we pose these to our colleagues in the field of gerontology. There's some questions here, which are basically what I have here. How can policy and practice continue to support the healthcare and social needs of older adults in a way that recognizes heterogeneity of individuals, despite the societal biases of various groups, including the elderly themselves? How can gerontological education at all levels, from elementary schools through doctoral programs, embrace the rich and complex history, old age throughout the centuries to help rediscover and perhaps even redefine what it means to continue to grow old? And finally, how can we move forward with scientific advances in gerontology research without privileging complex statistical models over individual experience? So I put that in there because I'm a qualitative researcher. The quantitative stuff is really important. Gold standard is a mixed methods approach when we are researching and studying old age. But that qualitative element, what is it like to grow old, particularly in this country, is very important. So that's enough talking for me. And I know that some folks have left the class, but for whoever's left, Dr. Brown, if anybody has any questions, I'm happy to answer them or talk about whatever you guys want to talk about.
Awesome. Thank you, Dr. Niles Yokum. And so if you guys have a question, I would ask that you unmute and ask your question. And or if you're uncomfortable with that, feel free to type it in to chat and I'll read it. We want to thank you, though, for really talking about how all of the difference of why we pull social policy and the difference of public policy and social policy. And we do talk a lot about from a social justice standpoint, because being a HBCU, our mission is one of access, and our mission is one of really working with first generation and minority students. And so I know Dr. Niles Yokum is at the University of LaVerne, which is a Hispanic serving institution. And so she and I have these conversations a lot of times about what is it like to work with first gen students, and how can we better serve our university in assisting our students understand what social problems can be looked at from a sociology, a public policy, and a social justice standpoint. And I think that what she did today was really show how if we define it, and this is one of those things we talk about in intro and in social problems, which all of you have had, if society defines this as a social problem, then how do we go about changing it to help alleviate the problem, to help fix the problem? And the main way to do that is through policy changes. And so, I think that you guys should go back to this at a different time and really look at how this also can fit into your undergraduate studies and even hopefully your graduate studies. So any questions? We'd love to hear some questions. Any comments?
I would say also a great kind of example, real life example right in front of us right now, is looking at COVID-19. And when this first started, I did an NPR interview, and one of the things I talked was the impact on Corona on older adults. Mm-hmm. And I was on with a geriatrician from UCLA. It was him and I together. So I'm a social gerontologist. And so he was talking about the effects and the impact. And I was like, hey, I used some of the examples that I saw on Twitter and on social media about, hey, I'm not worried about this. This just affects old people. Let the old people die. And it's just a great, case study in ageism in our country. And so this was in March when this all first started. And I said, if you think, that this is an ageism and that really worrying about COVID-19 is only for old people, that's the wrong way to approach that. That is an ageist approach. It's a wrong way to approach it. And if this is how the solution to COVID-19 is going to be faced, boy, we have a long road to hoe for that, for sure. So it's still happening, but we're seeing that it affects young people. We're seeing that it affects everybody. So everything comes to light eventually.
And I'll see if I can find that NPR interview, because I know that we were talking during that week right before your interview, and in what we were seeing, because with her being in California and me being in Georgia, and us having the big outbreak here in Albany at the very initial in February, that really put us on the map. And so that people were like, oh, is that where you are? I'm like, yes, that's exactly where I am. So, we've all kind of navigated this probably from a different perspective. I think in the next couple of weeks, we'll have Dr. Hallie Baker, who's been in Ohio. And although she's in rural Ohio, they too are being affected. And so it's reaching to every single corner. And the other aspect of it's only hitting old people. It's only hitting people with pre-existing conditions. It's only hitting minorities. This is hugely, really not true. And
Nope.
and it's people who are not who have been sick, and so they're sickly, and what can they contribute to society anyway? So it's
right,
yeah.
And what it does, so it's racism and it's sexism and it's ageism, right in our face with this
Classism
going on. And it's also, ripped the Band-Aid off of this hidden kind of this hidden issue we have with healthcare, for people not to have access to things, for people to be getting bills for this, for people not to have access to testing. And if you think about older adults who can't get out to get tested, right? They're at home, just like do I have it? Do I not have it? So yeah, I mean, it's shown the dirty underbelly of our healthcare system, of our ageism, of our racism, really of everything in this country. And if this isn't the time to really be thinking about changes in values and changes in social policy, public policy, and things that need to change, similar to Katrina, right? We saw what happened with Katrina, and there was a lot of change. Even though it was mostly old people, right? That was the biggest proportion of folks that died and were affected by that. We had some changes in FEMA. We had some changes in regulations to skilled nursing facilities and assisted living facilities. But I don't see much of it. It gets written and it gets put on a shelf, and what happens from there.
And this is as you guys look and write your career and aging paper that is due this coming week. And one thing that you might want to look at too is just the knowledge that you've gained from this perspective of, you don't have to be, and I tell people this, you don't have to go to DC to change policy. You can change policy in your backyard.
Yeah.
It is about local politics and changing the policies that go along in Albany or in Savannah or in Atlanta or wherever you live. It is about making sure that these policies are changed. What we do is we start small, and this is so important for all of us to remember. The policies that are at a federal level affect us, but a lot of the policy that affects us is at the local level. Whether and one of the big things, if you talk to me about my involvement with local policy, one of my biggest things is why we need to ban the box. We need to mitigate marijuana arrest because it's, come on. Atlanta has done it. Macon has done it. Savannah has done it. Columbus has done it. Athens has done it. We have all these large cities, and we're a large city with a minority population. And my argument is we are incarcerating large numbers of our population who honestly are out there working and are taxpayers, and we're locking them up for marijuana in the city of Albany when we could just simply charge them a fine like everybody else is doing statewide. And so these are things that when I look at and I argue at a local policy level, it doesn't necessarily have to be aging. It can be whatever it is that you are passionate about, but it is about moving into that arena of changing policy. Several friends of mine from high school and college have gotten involved in campaigns, are actively campaigning, or running for office. This is about changing policy. This is about making a difference in your community. When I was at Winston-Salem State, I had two students who said, you know what, I'm done. I'm running for school board. I'm running for so-and-so. I'm running for this office. I'm running for commissioner. They ran, we backed them, we campaigned for them, and they won. They were college students. College students that won seats on the school board. College students that won seat in county commission. And you know what? It's so important because where we live is where we have to start. It's a grassroots effort of policy changes. And you may think that this doesn't matter. But I'm going to tell you something. In the time of COVID, some of the things that we see are really trickled down to local policy. I mean, if you look at our local policy based on what we've been doing in Albany versus what other areas of the state are doing, we're instituting policies that are more helpful. And I think that this is where you guys can look at this as a career opportunity. And like I've said, we have graduate programs at ASU for this. We also have access to other people. You can call Dr. Niles Yokum and talk to her about going to graduate school at her university because some of her stuff is online. Some of her programs are online. Some of her graduate classes are online and her degree is online. So as she's changing some of this up and as COVID is coming in, I think we're going to see more of this. So you don't just have to focus on one area. Feel free to expand. But if anybody has questions, we'll take those. Yes, or we'll call it an early day. It's up to you. It's your class. So chime in on chat. What would you like to ask questions, or you ready to go? I'm going to actually take this off of record, and we want to say thank you, Dr. Niles Yokum, for coming as I close the recording out. And
I wanted to say
ahead.
a couple things about voting, right? So we're in an election season right now, and I do feel very strongly about local politics. So, and I feel like a big problem we have in this country is people who just vote every 4 years for president. So if you think about, how things happen, how things work in this country, the political process, the local votes are more important. Who we send to Congress is more important. Voting for your local officials, voting for your state, right? Your congressperson, your senator. We have 2 houses. Things don't get passed unless those houses agree, unless we can figure things out. Sure, the president has executive powers, but things really, really happen at the local level. So if you think what you do at the local level doesn't matter, it matters. Those local elections matter more than anything. I'm not saying don't go vote in November for president. Please, please go vote. But it all matters. And I think this, figuring out what you want to do with your life or your career or advancing in your current career, this background in gerontology is going to do things for you. I think, this is always my pitch to students. Why do I want gerontology? Why should I care about this? It doesn't matter if you're going into a bank job, if you're going into marketing, if you're whatever your other discipline is, whatever your career path is. And Dr. Brown was talking about school board. If you think about the number of grandparents raising grandkids, that's an issue in the schools, right? If you want to go be a teacher and it's K through 12, having a background in gerontology is really going to not only further your career, but give you an insight and a knowledge that not everybody has. And a big issue for me is all of the people working in the aging network at whatever level that have never even had a gerontology 101 class. I would love to, just infuse gerontology at all levels for anybody that has anything to do with aging at whatever level they're working in should at least have a gerontology background. And we're kind of moving out of that. Aging used to just be a job. Go be a director at an area agency on aging, but I don't have a background in aging. That's also an ageist kind of view of things, that anybody can do anything. If you have a grandparent, you must be a gerontologist. And so I think being an advocate for gerontological education is also very important, and that it's valuable.
I think that Dr. Van Dusen will be coming toward the end, and we'll be talking about exactly what you just said. And I'll introduce also some of the information Dr. Kraut used to use, Dr. John Kraut used to use, as far as one of the things that we absolutely have to look at is just because you have grandparents doesn't mean that you understand the aging process. It doesn't mean that you understand the diversity within aging. Yeah. And so it's always very fascinating, having taught those intro gerontology courses at Miami, Ohio, at Central Missouri, and Winston-Salem State. One of the things is I always get feedback from students of, well, this was a dumb class because I have grandparents. And I'm like, yeah, but your grandparents fit this mold. Mm-hmm. And now we're talking about aging across the board. And it's like saying, well, I can fix a car because I drive one. It doesn't make any sense. And so I think that, Dr. Van Dusen will be talking with us about that some, as well as Dr. Baker. And, I'm glad you brought that up. It's huge. Yeah. And whatever we do, we've got to deal with older adults. I mean, it's just, as we're aging, I start looking at my gray hair coming in, and I'm like, I'm old. I realize I'm old. I'm young old, and I don't care. I'm okay with that. And this is
because you're educated and you're not afraid.
Exactly.
But there's also, I would also encourage students to get involved in organizations that advocate for older adults, like Southern Gerontological Society, American Society on Aging. There are great student groups. And actually, that's how Pam and I met. I was chairing the...
Don't tell them exactly how we met.
I won't give your secrets away, but I was chairing the K through 12 committee at the Association for Gerontology and Higher Education. And I knew Pam had a background in K through 12. And so it's just an example of how big the field is, how broad the field is, and that we touch every part of it. So if you think about having a K through 12 committee in an aging organization, why would you do that? Well, because we want to infuse gerontology in K through 12. We don't want just students coming to us in their college days and saying, wow, I never heard of this. Everybody should, it's like death and dying. Everybody should know about this, and we should start educating children at the K through 12 level about this as well, and normalize it. That's the issue, is normalizing aging, right? It's such a separate issue. And that's reflected in our values. Like, why is it not in K through 12, right? Why do we have to just stumble upon it? And it's this separate entity that, nobody wants to deal with because it's not sexy, but we're all doing it. We all hope to do it, right?
Well, and like I always tell people too, we're going, if you think that you're not going to do anything in aging, you are. If you're fortunate. Mm-hmm. If you're lucky, it will be you who is aging. And so even the knowledge that you get from an aging class is beneficial for your perspective personally, because then you see where ageism has surfaced. You see where policies are not working for you. And we've worked on things of national organizations where we've had to point out and say, excuse us, this is ageist. The facility that we are using is not age friendly. And so even people who work in aging are not immune to being ageist. They're not immune to not recognizing what needs to happen. And so, we're just trying to educate you guys to move forward.
I think that your example there is something that I try to encourage my students to remember, that once you get into gerontology and you start studying aging, you have a duty to be an ambassador, right? Even if you don't want to get into politics and you don't want to do this or that, or you want to keep it local, or, just to your schooling, even things like, saying something about an ageist joke, or, the things that come down in everyday language, the language that we use. It's your job to be an ambassador. And that is being an advocate. That's being an advocate for your field and your discipline and for older adults. All those little things matter.
Mm-hmm. Exactly. Okay, well, I'm going to turn off the recording at this point, and then we'll open up. It may be that we're recording and no one wants to ask a question.
Also, I'm totally available.